Good morning, everyone. It looks like most people have been able to join the call, the Zoom meeting this morning. Welcome. It's a pleasure to welcome you to today's webcast sponsored by the Oregon State University Foundation. My name is Grady Goodall, and I'm the Director of Development for the College of Liberal Arts here at OSU. I will be your host for today's talk about the influenza pandemic of the early 20th century and how it relates to the crisis that we are experiencing today with COVID-19. I'll introduce our speaker in just a minute. We're delighted, but not entirely surprised to have over 200 people register for this webcast. We believe in the College of Liberal Arts and all of OSU that knowledge is absolutely vital to understanding diversity, complexity, tough challenges, the way that we live our lives every day, and applying lessons from history so that we don't have to repeat the mistakes of the past. This is especially true during challenging times of uncertainty and anxiety like we're facing right now. But I think that the history and learning what's come before us can also provide comfort in these times as we all manage. So thank you, everyone, for joining us, being here today. This is the second of a new series of OSU Foundation webcasts that we're calling Knowledge Breaks. We have an incredible range of experience and talent among our faculty at the university, and we're excited to introduce a few of them to you and give you opportunities to interact with some of our most brilliant creative minds in academia. Before we start, I'd also like to say thank you to our donor community for showing up and helping our students during this challenging time. Many of our students are having a difficult time. They've lost their jobs and they're uncertain. And your support is truly helping them continue their education and stay on track for their entire lives. Through the Beavers Care Initiative, which is an initiative to help support our students right now, 900 donors have provided more than $500,000 in gifts to support students affected by COVID-19. These gifts are helping our students meet their basic needs, stay on track to graduate, pay their rent, buy food, buy their books, everything that they need to right now. So thank you to all of you who have participated, and there's more information on the OSU Foundation webpage if you'd like to know more about that initiative. Today we're doubling down on those efforts because today is Giving Tuesday. It's a global day of unity as a response to the urgent needs caused by COVID-19. So for more information, again, please visit our webpage and you can go specifically to beaverscare.org. That's beaverscare, one word, beaverscare.org. Now for a couple logistics about the talk today. If you look at the bottom of your screen, you'll find a Q&A button. If you are welcome to type in questions throughout the session, and I'll be keeping track of those. After our presenter gives his presentation, we'll come back to those questions. Many of you also submitted questions beforehand during registration. There's some great questions there, so we'll do our best to get to as many of those as we possibly can. College of Liberal Arts and the OSU Center for the Humanities pride themselves on empowering OSU students and community members with evidence-based knowledge and fantastic scholarship, critical thinking, creativity, and communication skills. These tools help our students and our community engage in discourse about important and timely topics, including COVID-19 and other things that are happening in the world right now. We simply couldn't do this work without the support of donors. The Center for Humanities was actually started with a generous endowment in the early 80s and still functions today off of gifts from donors to those endowments. So thank you for everyone who has supported OSU, the College of Liberal Arts, and the Center for Humanities over the years. We're extremely grateful for all of your support, and hopefully today you get to see the impact of the kind of support that you've given. All right, so I think we are ready to jump right in. Our speaker today is the director of the OSU Center of Humanities, Dr. Christopher McKnight Nichols. In addition to his role at the Center for Humanities, Chris is also a professor in the College of Liberal Arts, and a frequent guest on OPB's Think Out Loud programs. You may have heard him on the radio as well. He's written and edited 5 books, including the forthcoming Rethinking American Grand Strategy, and recently his essays about the influenza pandemic of 1918 have been appearing all over the country, all over the world on the internet. Chris is a member of the prestigious Council on Foreign Relations. He is a Carnegie Fellow and a board member of the Oregon Historical Society. He's a terrific example of the kind of fantastic talent that we attract from all over the world to come to OSU. He's always a pleasure to work with and one of my favorite faculty members to collaborate with. So I'm pleased that we can bring him here today to talk about this topic. As I give the floor to Chris, please remember you can submit questions with the Q&A button down below. I see a couple of you have already done that, which is great. And with that, take it away, Chris.
All right. Hey, thank you very much, Grady, for that generous introduction. Thanks to Isabel Nissen and to Nancy Shanks at the OSU Foundation who helped pull this off. And most importantly, thanks to all of you for being here. I wish we could be together in health and happiness, in some sense of normalcy. But unfortunately, that's not possible. And so let's hope together through some community, some conversation, some analysis, and some hard work with social distancing and hygiene practices that we get to a place where we can do this kind of thing together in the same space. So what I'll be doing today is a short 2 pieces. We'll do one piece, which is a march through the history of the influenza pandemic of 1918 and 19. We'll look at how it spread through the US and around the world. And I'll talk you through some of the processes through which the US and the world attempted to grapple with the challenges of the deadliest modern pandemic in world history to this point. And we'll also then, a brief wrap up will be a kind of global perspective. Throughout this, I will try to wrap in concepts and connections that bring us to the present, that show some of the ways that this past history can illuminate the fractures and failures of contemporary society, but also the possible successes that can be made if we apply some of these lessons. And at the outset, I'd just like to say too, look, I'm not an MD and I'm not an epidemiologist, I'm a historian. But I'm a historian who studied this period very closely. I've special edited an issue of the Oregon Historical Quarterly on World War I. I started as a historian of the Gilded Age and Progressive Era, written extensively on this period, on this topic, and World War I in particular. At the end, I'll have a list of some select references. There are some fantastic scholars and books and articles and primary source references that may interest you that I'm relying on for this talk as we go. So I'll march into it now. I'll share my screen with you so you can see some PowerPoint slides that I think will illuminate this sort of stakes and really help us visualize and view the moment, the era of the pandemic of 1918 and 19. So here we are, here I am. Thanks to Grady's kind introduction, you have a sense of this already. And thank you for thinking about the insights of the liberal arts and the humanities at this particular moment. So history, lessons, and insights from the influenza pandemic. One of the ways that I like to start and think about this issue, and one of the things that reinforces why it's so important for us to look to this history, is to begin with the social experience, the costs, the human costs, and the tragedy of the pandemic. This sort of tragedy that we saw between 1918 and 1919 affected the world. Something on the order of 20 to 30% of the world population was infected. While scholars disagree on the exact numbers, you are looking at somewhere between 50 and perhaps as many as 100 million people around the world died between 1918 and 1919. And in the US alone, 675,000 or thereabout died. That was about 0.66% of the population. And a significant number of them, the majority in fact, died just in fall 1918 during the worst second wave of the pandemic. And as you think about those staggering numbers, it's useful to personalize them, right? The tragedy at the end of the day was felt by families and communities, by loved ones, and their broader sets of connections. And so here's an example taken from the memoirs, the memories of Victor Vaughn. Dr. Victor Vaughn became the US Army Surgeon General. He was the Dean of the University of Michigan College of Medicine. And when he gets to Boston, where the first big outbreak of the fall takes off, though he had experience dealing with smallpox and measles and other communicable diseases, he was astonished by what he saw. As he says here, they're placed on the cots until every bed is full and yet others crowd in. The faces soon wear a bluish cast. A distressing cough brings up the blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cordwood. This is what we're trying to prevent today. This is what we're trying to prevent in the future. And this is what so distressed medical health professionals in 1918 and 19. They simply couldn't stop it. The best preventative measures that they had against the influenza pandemic of 1918 and 19 were not direct medical interventions. They were what we call non-pharmaceutical interventions, what we would now call social distancing and closure policies. So then, like today, we see very similar sorts of social, political, and public health processes that unfold to try to stem the tide of the ravages of disease. So when did it begin? How did it begin? Began in March 1918, February, March 1918. Here's an emergency hospital camp at Camp Funston, Kansas, Fort Riley, Kansas. This is where we saw the influenza epidemic take off. And some pundits and politicians have suggested that we simply don't have enough evidence from the past to know if closure policies and social distancing work. Well, we certainly do know, actually, from this era. We know from 1918 and 19 because first, through military channels, combat effectiveness, troop transports, absolute numbers of hospitalizations and fatalities were recorded in this era. So we've got a lot of data. Mortality statistics are quite clear from this era as well. And then we've got a plethora of social historical examples. We've got media accounts, we've got correspondence, personal diaries, and all sorts of things like that. So should anyone suggest that we don't have a good enough evidence base to understand this moment, I would say they simply haven't looked at the evidence. And as this flu takes off, it comes from Kansas, not from Spain. And we'll get to that in a minute, why it's called the Spanish flu. Most likely it comes from Kansas. Now there's some disagreement in historical circles and among epidemiologists. There may have been some virus that's quite similar that mutates into the virulent form that we know of as the, quote, Spanish flu. It may have come from France, it may have come from China or Vietnam, but the virulent form of flu, there's a wide consensus that it comes from Kansas in February, March 1918. And this is a good example here. A soldier recalled that of the 12 men who slept in his squad room, 7 were ill at one time. But what we should take about this, take from this first moment is that it wasn't as bad. The most virulent strain, the most damage is done not in spring 1918, but in fall 1918. And one of the lessons we can take from this is that because of ill preparation and wartime needs, actually the media and government in the US in particular, the Wilson administration, didn't publicize information about the risks of the flu nearly as much as they could have or should have. So by the time that the ravages of the flu take effect in the fall of 1918, they really could well have learned better. And we'll talk about that as we go. So, well, how does it transmit around and why is this moment so similar to the present? The single biggest reason is that American troops and soldiers and war material in that era were the primary routes of transmission. They were the vectors of transmission in this era. It was effectively a globalized world in that era. And so you see very clearly from Kansas moving to the east coast of the US, you can watch the flu move through the US military and then across the Atlantic and then around the world. So between March 1918 and June 1918, the flu goes from Kansas to Algeria to New Zealand. It travels the whole circumference of the world, and it does that through largely military transport networks. But effectively, the world is globalized by 1914 when the war breaks out, and certainly in 1917 when the US joins the war effort in April. And as American troops muster and come together to rally, you see lots of young, healthy men in particular coming together, and they, in fact, were the most at-risk group. Something like 1/2 to 2/3 of all those who die of influenza in these years come from the 18 to 45 age range. So unlike our current COVID-19 crisis, this flu crisis of influenza in 1918 and 19 disproportionately hit that middle swath of the healthiest people. And we'll talk a little bit more about that as we go. As it went around the world, you could see quarantine camps being set up. Here's Wollongong in Queensland, an image from the National Museum of Australia. And just to give a sense of the global dimensions and the global scope, the same sorts of practices of public health were shaping the responses around the world. But really, the Great War provides the most important context. World War I is essential to understanding the pandemic of 1918 and 19, and it's essential to understanding the spread, and also some of the reasons why public health measures and national, as well as local and state responses were more modest. So here we see an induction camp in Syracuse, New York, and French forces on the Western Front. This many people all together are a prime way to transmit disease. And in fact, during these early moments, you saw some minimization of the ways in which the flu was operating. This was largely coming out of a kind of nationalist or hyper-patriotic set of sensibilities. Here's the Red Cross sort of thinking this way. Here, Red Cross volunteers making gauze masks later in the spread of the flu. If I fail, he dies. This kind of sense of patriotism, of the stakes of the challenge of fighting the flu, that comes later. At first, the challenges of fighting the flu were thought of as too significant to be undertaken because potentially the flu would not be so bad. And the advertising combat ineffectiveness, for instance, or anything undermining the war effort would be a problem. So as we think about that, well, why did that happen? In both the US and the UK, there were measures to restrict the media from covering anything that might undermine the war effort and preventing citizens as well as institutions like the media from speaking out. So in the UK, you had something called the Defense of the Realm Act of 1914. And in the US, you had something called two things actually, the Espionage and Sedition Acts. This is the Sedition Act, 1918, which punished those who attempted to speak out. And these were some of the ways in which free speech related to the risks of the flu or publicizing how it was actually jeopardizing the ability of the US to develop war material, to send troops to the front, and undermining the overall war effort were quashed. And so this atmosphere of the wartime itself prevented more proactive measures earlier in the spread of the flu crisis. You might think of that in another way, a kind of weaponization of the flu comes out of this, but so too do free speech practices. In the US, for instance, people like the socialist Eugene Debs were actually jailed for speaking out against the draft and the war. And so similarly, you saw this kind of thinking about releasing any information that might do the same. And thus it looked something like this, that people minimized in the US and in the UK, the Spanish flu, so-called, as an old name, as a new name for an old familiar disease. That the Spanish influenza was really just a 3-day fever. And so if you're thinking about those troops we just saw on the French front, on the Western front, they often would recover from these 3-day fevers. And so the push of this era was to minimize it, to suggest that really this was not as bad. And at first in the US press and the British press, to make it seem like this disease came from Spain, in fact. So why the Spanish flu? Well, because of the wartime strictures against free speech, against the media speaking out, efforts to minimize and to think more optimistically about the flu as just another cold or the grip, as it was sometimes called. It wasn't until May of 1918 when King Alfonso XIII gets very sick with the influenza. And when he's very sick, same with several other members of the aristocracy and some of the upper class. And so the Spanish press actively publishes on this. Spain at the time was a neutral nation and non-combatant in the war, and didn't have the same strictures against wartime speech. And so when the British press sees this, this coming out, and this is a clip from the US wire service later on, based on Spanish media accounts. When the British press gets wind of this, they start arguing that the flu comes from Spain because of the, quote, climate in Spain, and suggest that Spanish hygiene was the real cause of this. And the arguments here from the British press that are then picked up by the American press sort of do two things simultaneously. They first weaponize the flu because there's this sense of assumption that the Spanish were actually tacitly supporting the German and Austro-Hungarian wartime cause. This was because of loose linkages through the Habsburg family and sympathy at the aristocratic and sort of oligarchic areas of a Spanish government. But it was also because of this racist vision and version of climate and hygiene in Spain as giving rise to the flu. Being unclean or unhealthy was helping generate the flu. And so in this moment, it becomes the Spanish flu, a weaponized version, a politicized, a racist way of talking about the flu. As you'll see later, I have some media coverage. By the fall of 1918, virtually every medical professional in the US and the United Kingdom know that the flu did not originate in Spain, and yet they continue to use this term up through the end of the war in November 1918, helping us to see how this was a weaponized use of the language of the Spanish flu, and again, drawing a connection to the present. And I would add that the Spanish like to call the flu then the French flu, because they thought that French migrant workers through wartime efforts might have brought it. And you saw the Germans refer to it as the Russian pest. And a number of other nations did something similar. Again, this kind of racialized, politicized terms about viruses are somewhat useful, and they were for those nations, especially in a wartime environment. So if the first wave of the flu didn't do as much damage, the second wave really does. If you're thinking about the first wave, on the British side, for instance, the British Grand Fleet had something like 10,000 sailors admitted to their medical wards in the first wave, so spring, March, April, May, into June, but only 4 died, are recorded as having died. And then similarly, in April and May, troops on the front line on both sides came down with the flu, again, this 3-day fever version, and often recovered fairly rapidly, although there were posts that were hit very badly and show signs of what's to come. The sort of writing was on the wall that it could be a lot worse. For example, in one French army post of roughly 11,000 troops stationed there, almost 700 were hospitalized and 49 died. That's roughly 5%, and that's in the first wave. So when the second wave comes roaring back in late summer, August and September, but particularly August is when we see this in Switzerland and in Northern Europe. You can find in the US Army intelligence records, in British intelligence records, the operatives sending back secret reports where they say, what's happening in Switzerland is going to happen here. It's going to happen on the front, and it's going to hit our troops very badly. Watch out, beware what's happening. The sorts of things that they said were in reports marked secret and confidential. The disease, now epidemic throughout Switzerland, is what's commonly known as the Black Plague, or the Spanish sickness, or the grip. They noted that some posts had as many as 80% of their troops out of combat effectiveness, and that death rates were skyrocketing. So in this moment, you saw that. But the results in the US, when it comes to Boston in August and early September, and when the influenza begins to arrive by troops transports back across the Atlantic in the US, is that the Wilson administration and public health officials minimize it. They don't respond to these reports and public health folks raising a red flag and being concerned with much at all. And in fact, you see public health officials saying things like, as I've written in an op-ed in the Washington Post and in the Oregonian, saying things like, if proper precautions are taken, there is minimal risk. But they knew this wasn't fully the case. Or they would say things like, the Spanish flu can be contained to only military barracks. And they attempted some projects like this. They used receiving ships and quarantine principles to keep ships coming back from Europe off the coast even longer, and yet the flu gets into the US. If you've been following this much, reading up on your history, you know that the big contrast here is between what happens in Philadelphia and in other cities. Philadelphia in September 28th, 1918, held a Liberty Loan Parade. To that point, it was the largest parade in the city of Philadelphia. Despite the fact that there were hundreds of cases now being reported, were they the common cold? Were they influenza? Were they something different? This was being debated, but public health officials knew that holding this parade might be a problem, sort of a perfect storm of timing and a perfect storm of epidemiological crisis. And so they hold this parade against the wishes of some folks, and because the Wilson administration is pushing forward with the war effort at this critical juncture in the war. Remember, the war ends in the middle of November, and the US is trying to sell these Liberty Loan bonds to help support the war effort. Philadelphia is utterly devastated within days. Within a week, you see something like 2,500 have died. The hospitals are overrun. All 30 or so hospitals are filled up. They have to make and build new hospitals, temporary facilities. Within 2 weeks, you have something like 4,500 die just after that parade. So by the middle of October, they rapidly throw on closure orders and social distancing practices, so-called ventilation techniques of taking the windows off transit and other vehicles. It's moving so fast that as this moving quote suggests, in some families there are none left to take care of burying their dead, and others are unable to bury them or cannot get undertakers. There are some examples in the press from this moment in fall 1918, where the clergymen who are trying to pick up bodies, who are driving the carriages trying to pick up bodies, simply do not have enough room, and bodies are left on street corners in this moment. Here's this horrific example from this photo from the National Archives. This headline: "Husband and infant dead in a few hours, woman dying." So another thing to think about in this moment in comparison to our current moment, the incubation period for this virulent form of influenza was 1 to 2 days. Sometimes people would reported to have just dropped dead. And it hit disproportionately healthier people. In fact, this is hypothesized to be because of the way in which immune systems overreacted, frankly. It's called a cytosine storm. We could talk more about that in the end. And so Philadelphia minimized. They start with some stop spitting, like this, halt the epidemic. You don't yet see the mask protocol there. Here, you see a quote from the president of the West Philadelphia Medical Association saying that the public should be educated to the fact that the disease is not as deadly as many believe it to be. Does that sound familiar? The editors of Philadelphia Inquirer, unlike the Evening Bulletin, so you see on the left here, my quote from the Evening Bulletin, taking very seriously the social costs. On the right, the Philadelphia Inquirer was more interested in businesses and said that the strict closure orders go too far, and they make a case that schools, churches, and theater closures were generating, the closures of them were generating too much fear and panic. They urged things like, just move on with your life, but take some precautions, get good food, eat well, exercise, work, that sort of thing. You know, a little bit later, the Wall Street Journal reports that the fear that's engendered by the immense losses here, and then the fact that the pandemic was hitting such healthy people, the fear itself was stopping production or limiting production, as this notes, decrease in production of approximately 50%, and almost everywhere it has occasioned more or less falling off. The impairment of efficiency also has been noticeable. One of the things, we don't have great economic data for this point, but one of the things that's reported by owners of factories, by the business press, is that even when these were deemed essential war operations, so industry related to building tanks or ammunition, lots of people didn't show up, either because they were sick or because they were afraid. So one takeaway of this moment, whether you're no matter which press account you're reading from this period or medical professional, by late fall 1918, it was very clear there was no such thing as business as usual in a pandemic. Here's an example of the St. Louis Red Cross Motor Corps getting ready, standing ready, and there are numerous kinds of images like this. Particularly women were mustered for this effort, the Red Cross and registered nurses, and that's partly the product of the fact that so many male doctors had been drafted into the war effort. But it's also partly the product of the ways in which civil society and these kinds of organizations like the Red Cross were taking off with very high numbers of women volunteers and workers. All right, so one of the things that a lot of accounts lately have talked about is let's think about the comparative responses, the so-called non-pharmaceutical interventions related to this. That is things like social distancing or providing good, honest, rapid information versus places that didn't. So we can compare very easily. There's a great Journal of the American Medical Academy, JAMA, article that talks about this. There's some fantastic graphs and charts that I've tweeted out in the past. We'll see a couple now. So here's Philadelphia, again, minimizing. They hold that parade. As you look here, the Philadelphia Inquirer, you get a sense of the fighting men of the Navy thrilling the vast crowds. And then you can also see a little bit later, scientific nursing halting the epidemic. Deaths now on decreasing scale. Cases average only 1,875 daily. Entire situation is well in hand. So nurses' sole need. And you also find it was very hard to get medical professionals to all the places that they were needed. Even in this minimizing piece, you see that just there in the headlines. So we've seen this. This has been a major conversation topic in recent months. Cities like Philadelphia that did not do proactive, preemptive social distancing and closure policies fared far worse in terms of mortality rates and in terms of spike. What we talk about nowadays is flattening the curve. They didn't do that then, but you can see it here. This is a nice visualization from the Washington Post. Philadelphia had that big parade. While you can't say causally for sure one-to-one relationship, most scholars agree that because of that big parade, thousands of people died and tens of thousands were infected. Whereas you can look to cities like St. Louis, where the St. Louis leader in public health was the son of a US Army surgeon a Union surgeon from the Civil War, who had his whole life been interested in questions of virus spread and disease spread. And he was empowered by the mayor of St. Louis to take proactive, preemptive measures. And though St. Louis suffered a lot, and I read about this in my piece at the Washington Post, of the top 10 cities, they did very well. They were right up there at the top in terms of mortality rates. Another way to visualize this is just very similar. You can look at it by dates. Now remember, September 28th is when that Liberty Loan Parade was, and watch how rapidly you see the spike of number of deaths per 100,000 in Philadelphia. Whereas you look at that flattened curve in St. Louis, sure, there's more duration there, but it's nowhere near the mortality rate. We can look at this in terms of other cities too. New York, like Philadelphia, comes a little late to closure measures, comes late to closure measures, in fact, and suffers fairly similarly, but not as badly overall. And then we can look to Denver, which is an illuminating case as we think about our present moment and what maybe even the next year entails. So take a look at that, and then we'll think more about Denver together. All right, so what happened in Denver? Well, Denver is a really fascinating case. There's a great essay in the Influenza Encyclopedia about the city of Denver, which I highly, in the pandemic, which I highly suggest you read. You can look here at the kinds of closure measures that are adopted and the way that there's this dip and spike, particularly here, right in the middle of November. Now, if you were attentive to what I was just talking about, that spike comes after November 11th, when they have, guess what? Armistice Day parades. The war is over. People come out. Tens of thousands of people come out. And they're led to believe by their local government that this would be okay. There was significant push to reopen in late October, when it seems like they've hit a peak. And so the business lobbies, a so-called amusement group that represented something like 2.5 million in capital businesses in the Denver area, were pushing hard to keep amusement facilities, or to get them open, things like theaters, restaurants, billiards halls, that sort of thing. And so they're getting things opened up, and then you get November 11th, the Armistice Day, and there's a huge spike. And so what historians of science, public health scholars suggest is that this is a great example, and a terrible example, of a premature reopening, that you need to follow a phased approach where infections, death, and disease really are going down, and they can be demonstrated in the record, and that public officials in particular need to hold their ground and to not be too swayed by special interests if your goal is health and safety, if your goal is to limit death. Another way to look at this is to look at how cities fared over time. We don't have a lot of time in this talk to go through this, but you can see how Philadelphia is way up there in the first wave. They've gotten a lot. This might be the most callous version of creating some herd immunity because of so much death and suffering and disease. Pittsburgh also does poorly in that moment. And as you go through, you can look to other places that then see a more virulent second wave or a longer endurance. And Portland, Oregon is an example of that Portland comes a little late to the closure policy, has some fits and starts over time. So what Portland is an example of is that the closure measures did well enough and reopening did well enough, but it prolonged the duration of infection, disease, and death. And so there are several different models. There are a handful of models here, too many for us to go through just now in this sweeping discussion. But these are the kinds of ways that we can know what we know about lessons learned from this moment. All right, wouldn't be a good talk on this subject if we didn't talk a little bit about the people who had the flu, including folks who lived through it who are quite famous. There's a great example in October. Babe Ruth caught it as he went off to his off-season job with the Bethlehem Steel Corporation, basically just playing baseball for them when he felt like it, near his supposed country house. And he got it. Boston had won the World Series that year in the middle of September, right before the ravages of the flu really hit the city of Boston. They were just beginning to. Baseball got an exemption from closure there as they finished the World Series. But so did Franklin Roosevelt. This is even before he had polio. Franklin Roosevelt, who was then Assistant Secretary of the Navy in the Wilson administration, caught influenza while on his voyage home. So he's another example of exactly what I've been talking about, that the flu was transmitted across wide spaces like the Atlantic, across North America, around the world, that no one was immune from it, even though then as now it fell disproportionately on minority populations and people at higher risk. But in this era, of course, the higher risk folks were young and healthy people. This time Roosevelt would count there, and so would Babe Ruth. So you're probably thinking a little bit about some of the questions we got before this talk. Well, what was happening with sports? A lot of people have been saying, hey, if we're going to be quarantined, we need sports. Well, a lot of college athletes and some professional athletes had been drafted. So you saw here in our state of Oregon, but this is true around the US, that former football stars like Bill Holden at the U of O were drafted and sent off to the conflict. You also saw quick closure policies happen. So it's a little complicated, but basically first, the US federal government said that sports should not be held. There shouldn't be sporting events or teams. And then they pretty rapidly said, actually, because of the war effort, because it's military style drilling to play football, for instance, it should go forward. But as this headline suggests, no rooters to see the game, right? That it would be played only with the ball players, doctors, and newspapermen, as they put it. So if we're worried about our rivalry games this fall, I know Oregon State is, they were held. One of the open questions was, would these games be held and how? What medical conditions would be, what medical interventions would be done? Would football players wear masks, for instance, under or in front of their headgear? Then they didn't have helmets, full helmets, of course. And that choice was left up to them. But you do see and I'll talk a little bit about this, you do see in other sports athletes choosing to wear masks. And there was no consensus national champion in football that year, for example. But one of the more telling athletic stories, amusement stories, leisure time stories is that this was really about the second year of the formal National Hockey League. And because of the flu, so many of the athletes, the hockey players, were sick. And in fact, one of the most famous dies of the flu, one of the most longstanding NHL players, hockey players, that the Stanley Cup actually comes to reflect the season ending prematurely because of the ravages of the flu in early 1919. So many were so sick that they couldn't play. And so they had ended with a tie in the Stanley Cup. That's how significant it was. They couldn't even play one more game. Baseball is another example of this. I bet a lot of you have seen these photos. So this comes from spring training games in in California in early 1919. And you can see in the background masked people in the bleachers, and the umpire, the catcher, and the hitter are all wearing masks in the beginning of that season. By the time you get to photos, say, or practices from the summer of 1919, no longer is that the case. There was a lot of misinformation and different kinds of information about the flu. We could talk a little bit about this in Q&A. You've probably learned some before. So doctors were regularly putting out reports how to wear or make masks, how much would masks help. These were just gauze masks, but they were very confident these might help. That fresh air was the thing that was most prescribed. Lysol, we've heard a bit about lately. Different kinds of soap and hand hygiene were really important in this era. The disease is spread by breath and secretions of the body. So there was a germ theory then. They knew that germs could spread on surfaces, for instance, and especially through sneezes and coughs. So they really looked to those as preventative measures. There on the upper left, you see Dartmouth College. On the right, you see that quarantine facility in Queensland. There is Washington, D.C., open air nursing happening, and influenza wards. And on the right, you see US military facilities before the end of the conflict. Ventilation then and sunshine, we've heard a lot about this as well, were thought of as treatment methods. You can look to the right, you see the sort of typical or stereotypical really tenement house or tenement apartment, dank, dark, dirty, not enough ventilation. How to prevent the flu, people said, okay, don't use common drinking cups or towels, cover your mouth. Don't visit poorly ventilated places. So in some cities and states, teachers who were out of work went door to door teaching home economics to people, talking about how to properly sterilize using Lysol or soap, and urging people to ventilate. Of course, in the military and across the US federal government, there were staffing crises and supply chains were at risk. And so you see here some federal government reports related to, for instance, the US Food Administration, the war effort. On account of the enormous amount of Spanish influenza here, it says, it's impossible to call any public meetings. And this is the sort of thing you see across the country. It was hard to keep the supply chain running, keep people informed of this, even with the government on a war footing, with significant central planning happening. Similarly, you see the sense that it's very important for members of the armed forces, you've probably seen these kinds of photos, members of the police and others to be modeling the appropriate behavior and to take precautions. So here you see the Seattle police with masks. Same thing with this ventilation and public health, public work. Typical urban scenes in fall 1918 would look like this. And what I want to point your attention to here is something we're seeing in the US now and are likely to see more of around the world. There on the left, you see the trolley conductor telling the guy who doesn't have a mask that he's not allowed on. In lots of cities, they put in ordinances that said to go into public spaces, you had to wear a mask. To go into public spaces like essential grocery stores or department stores, or to get on public transportation, you had to wear a mask. The argument that scholars have made since is a sort of social psychological one, which in brief suggests that people wearing masks are taking social hygiene and the virus seriously, and therefore that demonstration means that they're better equipped to deal with it in other walks of life. Those who aren't seem to be taking it less seriously. That's kind of the argument. And certainly from that era, we saw this. There were open air court cases. So one of the things that happened when there were closure policies was that this hope that things could be done outside and that the fresh air would be good. But of course you see people gathering in mass, places like San Francisco, then there become outbreaks. But you saw open air court cases, you saw open air barber shops. There you see a little bit better social distancing by those who are waiting. You saw mask wearing even when barbershops couldn't be held outside or barber activities weren't outside. Here's Cincinnati, Ohio, indoor with masks. And you saw open air college classes. Here's the University of Montana. Now they're not all wearing masks and they're pretty well together, but practicing this then thought of as fairly effective ventilation, open air practice, getting out in the sun. Lest you think I was kidding, here's an example still from documentary footage of US soldiers and sailors wearing masks aboard a ship in 1918 watching a boxing match. Again, look at this across the scope of society. You're seeing these kinds of behaviors proliferate. Now, of course, there's a lot of bad information. I don't want to go on too much more about all this, but here's a couple examples. Vicks Vapor Rub being sold out. People in the middle there are gargling salt water. People on the right there are lined up for a vaccine. It was a hope that there could be a vaccine, but that doesn't come. And in fact, the virus isn't really isolated until the 1930s and 40s. The flu travels through the mouthpiece of the telephone, so quit talking so much as one piece of advice. Or even the US Surgeon General arguing that there's no cause for alarm if precautions are observed. Proactive policies are exactly the same sorts of things. Coronavirus responses mirror influenza pandemic responses. Schools, churches, theaters being closed. The efforts to do social distancing. The measures then to put in place mask policies and other kinds of policies for hygiene and public health. cover your sneeze, cover your cough. Oregon, the Pacific Northwest, very similar. And again, this mirrors the national policy and set of plans. One thing that you can see in the Pacific Northwest is a clear transmission route from sailors coming from Philadelphia, going to Seattle, coming down the coast, bringing the flu first to Fort Stevens in the Astoria area, then to Portland through a private. We can track this down to one individual who had the flu, brings it to Portland on his way to training camps in Texas, but can't make it there and has to be hospitalized. As that takes off, then subsequent public measures come into play. And the key question then, as now, when you see those infections, deaths, and disease rising, how rapidly can cities and states take action? In places like Portland and in Seattle, there were a lot of cooks in the kitchen of public health. A mayor and a board and who was most empowered led to decision-making that was more diffuse and therefore took longer in general. Billings, Montana is another example. I don't want to go on too long, but we can find this in every city and state in the US and wrapped around the world. In Billings, a third or half of the whole county came down with the flu in the fall of 1919. Deaths get out of hand. And what I take from this, one reason to illuminate this is that in places that didn't have the public health capacity, you see much, much higher mortality rates. Billings did okay, but there's a small town in Alaska where 72 out of the 80 residents died. And that's because their health infrastructure was overwhelmed. And then people were so fearful that they wouldn't bring food or they wouldn't aid their neighbors. This is an example that comes from John Barry's book, which argues that the social structures themselves begin to fray without honest information, good, clear, coherent information and leadership from state and federal government. And in places that are more remote, they suffer a lot more. You saw too, lots of pushback, lots of efforts to lift the closure bans, very similar to today. These phased reopenings of that era are exactly what we're hearing about, different kinds of plans put into place by institutions of higher ed, taking their lead from governors and city leaders. And then you saw special interests of different types pushing to reopen. I would give you one conclusion, which is that both special interests in business, say restaurants and department stores, were pushing this way, but so were special interests in other communities. The most notable is clergy. In places with large Catholic communities, they pushed very hard to have short 30-minute masses on Sundays. And these became some of the first areas that people gathered, in places like Denver, for instance. And you can see them as vectors and loci of transmission. Very clearly, the people who are gathering for these church services or gathering for late night billiards halls were then spreading disease. Here's an example of what I just described: how to follow the rules. Use your handkerchief when you cough or sneeze, or bend your head towards the ground. Similar sorts of things going on in terms of public health policy and public health beliefs, how to avoid it, how to care for those who have it. This all comes late. So the Wilson administration didn't start issuing systematic recommendations until October 1918, and the flu was already hitting all over the place in September. By the time they're issuing serious recommendations about mask policy and closures, you're in the middle of October, and it's already too late in a lot of cities and states to take meaningful preventative measures. Remember, in St. Louis, for instance, that was happening in August. They started to issue closure orders, and in September, closure recommendations, or recommendations for less gathering, rather. And then in September, they're doing closures. So politics, this is something a few people asked about in Q&A. What was going on? Woodrow Wilson wanted the election to be a referendum on the war, on his effort to mediate the peace. Republicans wind up winning a whole lot of seats, and he's not happy about that. In some places, polls don't open at all because there's too much influenza. In other places, they mandate mask wearing. And in other places, they make arguments that business interests or other kinds of interests, particularly ethnic interests who wanted saloons open. Here you see this in Montana. Democrats, people who were in favor of alcohol, wanted saloons open more than churches. And so in that, you see in the Montana piece that folks should vote for Republicans because it was Democrats who wanted alcohol and saloons open during a pandemic. I can imagine this kind of politics in November 2020 for sure. Woodrow, you see suffrage advocates handing out bonbons to those at polling stations because, of course, there wasn't yet universal national suffrage, although women could vote in a lot of states by this point. And in 1920, part of the response by Warren Harding was to run an America First platform. It was against immigration, new immigration, immigration restriction, and for normalcy and for business and reopening the nation as it was. There was a lot of pushback. There's been some news about this in recent days and weeks. The most notable and famous is the Anti-Mask League of San Francisco. It's really fascinating. They come together, 4,000 or 5,000 folks. They did not like this hard ordinance that required the wearing of masks. So it wasn't voluntary, it was required. You could be kicked off public transport or not let into a department store. And they argue that but two things. One, their liberty was at stake. They used democratic ideas, just as we've heard in recent days, by having to wear these masks. And second, they argued against the utility. They said they're just not sure that these are so sanitary or that they might functionally be useless, which in fact, they could, you know, they were in some ways. But this gets ginned up. There's a lot of protest by the Anti-Mask League, but the mayor of San Francisco says, and you can read this in the proceedings, I think the mask policy is working. It's working really well, and I'm definitely not going to take this off. Finally, before we get into the last couple lessons, a lot of people ask about the economic and political effects of the influenza pandemic. There really aren't very good studies of business in this moment. There's a decent study by an assistant director at the St. Louis Federal Reserve. There's a number of papers that are fairly speculative by economists. What they mostly note is that high mortality and illness have enormous negative socioeconomic impacts, like death, especially death to healthy working people who are breadwinners for their families. Exposure to viruses and disease in the womb is really bad. That mortality over the long term is bad for communities, obviously, although it can lead to upticks in labor demand. Merchants and cities in that era, as I've already suggested, estimated losses in business of 40 to 70%. Mine work and other comparable sectors, output was down 50%. Unless we think that the 20s were really all roaring. There were recessions as the war ends in 1918 and 19. There was another recession, arguably the most deflationary recession in US history in 1920 to 21. And then other small recessions in 23, 24, and 26, 27. I'll finally add, and then get into our lessons, that there are impacts, clear impacts here in terms of the election of 1920 and a return to normalcy and a new party in power. Immigration restriction is one of the main ones that people very much felt that it was immigrant groups, dirtier, inferior peoples, Eastern Europeans in particular, they single out as those transmitting and being vectors of disease and populations of it. And so that factored closely with pro-business, self-sufficiency, anti-immigrant foreign policies in the 20s and 30s. So the last two takeaways. The main insights from 1918 and 19 are that where there were cancellations and postponements of large events, gatherings, and other activities, anti-crowding measures and social distancing, it worked. It worked to slow the spread and it limited death. These are non-pharmaceutical interventions. Second, most Western nations that were involved in the war, they attempted to control information, they minimized risks. The Wilson administration and the Committee on Public Information that propagandized for the war effort were among the most important in doing this. They were really exemplars in this. They did not get out good information to the people. This meant that citizens were ill-informed, that fear proliferated, and people who otherwise might have helped their friends, their families, their communities didn't. So honest information is key. Early action continued is better than layered. So if you only close schools, but you don't close businesses, the cities and states that followed that policy did worse. Reopening gradually, the inverse of that. Layered reopening with an eye to data and disease is clearly best. And in the end, in the US, the case of 1918 and 19 is pretty clear. It was mayors and governors. It was health officials at the local level. That's where the action was. Those are the places that either did the best or the worst. And finally, here's some recommended resources that I highly recommend. And if you email me, christopher.nichols@oregonstate.edu, or respond to our emails about this event, we'd be happy to supply some of these. John Barry, Nancy Bristow, Kenneth Davis, Laura Spinney. These are some fantastic books and articles that'll be good resources for you. So thank you for listening, and we have time for just a couple questions. I hope you've learned a lot and can apply the lessons of the influenza pandemic of 1918 to 19 in our world today.
Thank you, Chris. That was amazing. There's a lot of content. It's fascinating to see how much history repeats itself. We have some great questions in the question and answer section. Just a couple minutes to get through a couple of these. If people would like to stay a few minutes longer, we can certainly go a few minutes longer past noon, but we want to be respectful of your time as well. So let's get to a couple of the questions that were asked most commonly and see where we're at. Question about economic recovery and some other questions about sort of how did it end? You know, what did the virus sort of taper off and things came back to normal? How did the pandemic end in 1918 and 19? And how did the economy recover? And if you can do that in 30 seconds, that'd be great, because I'm sure you can just cover that really fast.
Sure. So as I tried to emphasize, the main transmission lines for the disease were related to troop transports and the war itself. So with the war ending in November 1918, you get a lot less immediate transmission. There isn't as much mixing of people, camps, induction camps, drafts, all that stuff that was helping to perpetuate the disease. And the stricture measures in fall 1918 really do work. So you see cities like Philadelphia showed that where excess mortality was enormous early on. But then because they followed some pretty solid social distancing kinds of guidelines, they did better over time. The virus dies out a bit in the spring. There's a third wave. There continues to be death and disease. The Portland example there continues into February, for instance. And around the world, it actually continues farther into the spring. But the one interesting and sort of sad takeaway from that we don't know much about, but we've heard about, is that the flu virus in particular seems to subside and mutate into the summer and then come kind of roaring back in the fall. So if you want something to worry about, we don't know about the coronavirus with regard to this. That did work both in that first wave. Remember, it sort of calms down in spring 1918, then comes roaring back in the fall or the late summer. Will that happen again? And you saw a bad flu outbreak again in the end of 1919. So there's some amazing photos, say, of Japanese schoolgirls and people in New Zealand wearing masks in that period. The economic information, the bounce back is interesting. So it looks like the places that did preemptive strikes of social distancing and other kinds of moves fared a lot better. That they come back pretty rapidly. And in fact, from what limited economic studies there are, that they don't see appreciable costs in the medium term. So by the mid-20s, there's no sense that the flu, in terms of their economy, has been a significant factor. But as I said, the high mortality rates in places like Philadelphia or Pittsburgh, some other cities, do have long-term tail effects all the way through the 20s, all the way to the Depression. You know, again, according to the economic literature on this.
So we're right at noon. We have, I think, at least two more questions. There are a number of questions you submitted, but they kind of gather around two main points. So I think I'll ask those two questions so we can address most of what people asked. If you do have to log off, again, thank you very much for attending. And thank you to Chris, and I'll wrap up a little bit after these two questions as well. If you're looking for a recording of this, you can look on our website for the Beaver Lodge. Go to the OSU Alumni Association, the OSU Foundation webpage, and look for the Beaver Lodge. That's where we post lots of content like this. It's available to you. We have another webcast coming up next week with Dr. Regan Gurung, Professor of Psychological Science and Director of the General Psychology Program at OSU, and he's going to talk about stress and coping strategies learned from psychological science, which I think is a very welcome topic that would be helpful for very many of us right now. You'll also receive a follow-up email with a survey where you can provide us feedback on this program and links to the Beaver Lodge. So if you have to tune out, thank you for being here. Let's get to two more questions here, and then we'll wrap up. So there are a couple questions in this list about understanding the relationship between flattening the curve and herd immunity. And that may be more medical or more historical. I'll let you figure that out, Chris. But did we see in these initial spikes, and then depending on the response, the level of the follow-up surges, whether there were 2 or 3 in different areas, do we know whether herd immunity was a significant factor in that eventual dying out of the flu, even though, as you said, there were a couple continuing spikes?
Yeah, so it is hypothesized that some places had something closer to herd immunity, the hardest hit places,
Mhm.
right? So the ones like the horrific account of Philadelphia, for instance, with bodies on the streets, or some small towns. Coos Bay in Oregon actually had such a bad outbreak, and their undertaker. It's a really heartbreaking story. The undertaker also has the flu. They run out of coffins, and then they don't. Some children are hit really badly, and they don't have enough child-sized coffins. And there's several accounts of this. It's just really devastating. Some of these places that had such a bad outbreak do appear to have far fewer infections and disease later in the like third wave. So we can hypothesize that they had some level of herd immunity, or somehow were enough off the grid, or were lucky enough to not get these other waves. Some places experience, wave after wave. So it's pretty clear they didn't have sufficient herd immunity the way we now understand it. It's hard to say. There's one interesting point that some historians of science have made, that partly, the flu then hit people between 18 and 45 disproportionately. It's at least half of the people who die, and even more who are hospitalized are in that age range. And it's really heartbreaking for people then. I mean, it's really astonishing for example, one of the supposed best lumberjacks, strongest guy in the Pacific Northwest branch of the Spruce Division, which was the War Works project doing timber work in the Northwest. This guy drops dead within a day. And all the other guys say that their accounts of this are, if he died, I could die, right? So they're fearful, but they're also astonished that some of the strongest, healthiest people in their communities are dying of it. And the hypothesis by some historians of science is that that it's possible that the older demographic had been exposed to a virus that was similar enough that it gave them some immunity. Now, we don't actually know that for sure. So I'm saying that, again, I'm not an epidemiologist or an MD, but that seems to have some traction. So one, people with strong immune reactions suffered worse then. And two, it seems like this older demographic is suspiciously able to deal with the situation. And so that's one of the hypotheses about that.
Well, thank you. And it was pretty clear from the data that even in places that had a big spike up front with possibly the idea of developing herd immunity, they in the worst cases, they had a much higher death rate overall, which is a really stark statistic. One of the things that you made really clear is the difference that the virus tends to be, we seem to understand now that it's attacking more people with pre-existing conditions, and maybe not the youngest, strongest, or most resistant to disease at this point. And that was not the case with the epidemic in 1918. It also, there's data, some data, at least early data now, that it's disproportionately affecting the African-American community, the COVID-19 virus is. Do we know if that was also true in 1918? Did it disproportionately affect the African-American community?
So there's pretty good information to suggest that that it hit unequally in 1918 and 19 in the US, and that people with lower socioeconomic status were hit harder. Places where there was more crowding, for instance. I mean, it's sort of, it's pretty obvious. So that the image of the tenement was one. This dovetailed really neatly with racism and xenophobia in that era, and the kind of the rise of the Klan. The Klan comes back in this era, really strongly anti-Catholic, anti-immigrant arguments. So Italian-American communities, Eastern European-American communities that are more crowded, new immigrants, they suffer more, and then they are stigmatized by the sort of Anglo communities in those cities and regions. And so there's a lot of politicizing of this. And I was very purposeful in showing that, in 1916, Woodrow Wilson and Charles Evans Hughes both used the language of America first as a kind of hyphenate Americanism as in their campaigns for the presidency. And in 1920, we see Warren Harding making that case. And what that's tapping into in that era is this sense of the authentic legitimacy of certain communities as really American and prioritizing them and not others. And so immigrant communities suffer worse and are stigmatized for it. But one thing that's interesting also, and a little odd in this moment, is that Jewish communities weren't hit as hard in some of the big cities like New York or Denver. And so Anglo-American sort of politicizing of that, they kind of don't know what to make of that. So there's a sense of a model or good minority in this era in terms of public health and disease, which is something we think of in lots of other contexts now, but would never usually think of in terms of a pandemic like that. And in the American South, the African-American community is hit very hard. There's a couple studies that suggest that they are several orders of magnitude higher in terms of death and mortality rates, particularly of the healthiest folks. And you need to go no further than thinking about segregated care, right? On top of having everything else, what little public health existed, say in rural Mississippi, was not going to be allocated to African Americans. It's really heartbreaking. Some of the social history accounts, diary entries from this are just like brutal.
Well, exacerbation of inequalities is really another heartbreaking impact of that pandemic, and we can all hope that we don't see as bad impacts and effects now. Certainly hope for those more positive results. It looks like we're a few minutes over time, and it looks like some people are needing to log off. So let's go ahead and wrap up today. Again, we will put a copy of this in the Beaver Lodge. You can learn more on Chris's website or at the Center for Humanities at OSU. Thank you again for everyone attending today. Great information, and we're so glad to be able to share brilliant faculty, their expertise, and the lessons that we can learn from history that apply to our lives today. Thank you for your support. Thank you for supporting our students during this time and for tuning in today. I look forward to see you at another one of our webcasts. Again, the next one is coming up next week with Dr. Regan Guru. Have a good day, everyone. Stay well and healthy.
Thank you for coming.